The options for fecal incontinence, accidental bowel leakage, huge problem. We talked about dietary modifications. We talked about optimizing stools, making sure the consistency of the stools is good, prevention of constipation. We talked about improving the pelvic floor strengthening with our physical therapist. We talked about that sacral neuromodulation, where you put a little battery that helps with the rectal sphincter nerves. What else? Well, if that does not do it, then especially if a patient has vaginal prolapse, things are falling out, and I'm repairing the vaginal prolapse, at that time, if that sphincter is broken up and disrupted, I could repair the sphincter at the same time. And that's called anal sphincter repair. It's done right at the lower part of the vagina, between the vagina and the rectum. And the procedure is not that long. I mean, granted, I put that sphincter nice and tight, so there is some discomfort post-operatively, but we take care of that by icing it big time, giving pain medications, and that works well. But in the olden days, the studies have shown that it's not as effective. Well, if it is done with vaginal prolapse especially, and I'm repairing it, and the sphincter is torn, repairing that sphincter makes sense. My first thing is to do that nerve modulation, that sacral neuromodulation, before doing that anal sphincter repair, because by itself alone, it may not be that successful over a period of time. So the good news is there are so many options that I discussed. Right from dietary modifications to pelvic floor physical therapy to sacral neuromodulation to anal sphincter repair. There is one pessary that also could be used that puts rectal pressure on the rectal sphincter that can be used temporarily. I don't typically use it, but that's an option available. But all these are therapies that are available for a woman who has bowel leakage. So looking at all these, it's highly unlikely that a patient will continue to have bowel leakage. In my practice, when they come to see me for bowel leakage, I take care of them step by step, and then maybe several things together, and most patients, if not all, are significantly improved and satisfied with their outcome of bowel control. So all in all, there is no need to live with this. Fecal incontinence or accidental bowel leakage is common. You may have it, your mother may have it, your grandmother may have it. Talk about it. Talk to them about it. And if they're suffering from them, bring them in, because we can take care of this and we can help them get their life back. There is no reason, like what Dr. Parks mentioned, to be a social outcast. There's no reason for the family to abandon a patient with bowel leakage. So much can be done about this, and they do not have to live as a social outcast, especially towards their, end of life, the 70s, not 70, but 80s and 90-year-old. There is so much that can be done improving the quality of life, because tomorrow you and I are going to be at that age. But that said, there are enough of the 30s, 40s, and 50-year-olds who have bowel leakage, and they cannot be ignored either.